Stop trying to grow backwards. Like, stop trying to be everybody else and grow as fast as them to buy whatever they already have because you don't know if they've worked hard for it or not, if it's organic or bullshit.
Mhm.
And focus on the internal of, okay, if my team's not strong, how do I make it better?
Hey, what's up, everybody? Cam Hemphill here, the Medical Millionaire podcast host. Thank you so much for taking the time to tune in. My goal is to give incredible value and insight for practice owners. If you're thinking about becoming a practice owner, you're looking to scale your practice, your medical aesthetics clinic, your wellness clinic, like everything under the umbrella when it comes to medical aesthetics and elective wellness. Every one of these episodes that we create, they're 100% designed for you and to help you elevate. So, guys, today, I have an incredible guest on. We have been talking almost for an hour offline. We met recently, and I'm starting to see her all over social media. She is absolutely crushing it. She is giving so much value and education, and she speaks nothing but real talk, right? And that's what I like about her is she's not afraid to tell you the truth on where the gaps are within your practice. And recently, I've been looking at a tremendous amount of practices, and going into 2026 there's this same theme that I'm consistently hearing, seeing. It's how do I market better? How do I run a console? What tech do I use? What website company do I go with? What EMR tech and what is all this AI stuff? What conference? It's this theme of being overwhelmed, and we really need to get back to the roots of how we grow a practice, how we look at our business, how we look at our numbers, and that's why I wanted to have her on. So, guys, I'm bringing in Stephanie Brand. She has a really amazing company called the Skin Jeanie. And Stephanie, welcome. Thanks for joining.
Hi, guys. How are you?
Like the audience loves this show and the podcast, and it's continued to grow. And I love interviewing individuals such as yourself because you've been in the industry for a long period of time. You've seen the pain, right? We were talking offline and you were saying, when I went to my practice that I had years ago, I had anxiety. And I want you to talk about that. So talk about first off your history, your
Yeah.
background,
Yeah.
and what led you to what you're doing now.
Yeah. Hi, guys. I'm Stephanie Brand. I am the founder and CEO of the Skin Jeanie Inc. I help establish medical aesthetic providers and practice owners, just really stop feeling like how I used to when that was chained to my business, overworked, overwhelmed, just all over the place. I didn't have any inkling of knowing what I was kind of doing, getting myself into, and I kind of did it the back way where if I could do it over again, I probably would definitely hire out consultants, people that are like, Cam and myself, and just really understand the business side of it, what you're getting yourself into, because that anxiety is real. That mental illness that comes with it is real. I am diagnosed with Crohn's and PCOS. So don't think for one second that you cannot get sick from something that used to make you thrive and be alive. And yeah, that's really, yeah, I'm here to spit all of it, all the truths about it.
No, it's awesome to have you on, and just to kind of build on that. You used to own a practice, right? And you've been in the industry for how long? 16 years. So you've been at this. You've seen this grow. You've seen this. GLP-1s is new for us that have been in the industry for a long period of time, right? Maybe it's
Yeah.
for some people are getting in because of that. We've seen the industry evolve.
Yeah, yeah. It's helping, it's actually saving my life. BPC 157, NAD, like, running business, brain fog through and through. But, having autoimmune, you usually have one that's underlying, and when my hormones were going all over the place, the first thing I did was try and go to an endo and a gyno, and they just tossed me around like a rag doll. And I actually found help with a woman named Alicia, and her practice is located in New York. And she helped me, her and my gastro helped me. She came in, she's like, we're doing all the panels that all the doctors don't do. And I'm like, okay, great. She's like, and we're also giving you peptides. I'm like, okay, great. Like, what is this? Amino acids, awesome. She explained every single thing to me, why I needed it. And I'm like, that's it. She's got it. Like, you know what I mean? I was not a number, I was a human. So,
Well, that sounds like a really good, productive conversation and consult.
oh my God, it was great. It was
Right.
awesome.
And that takes me to some of our talking points here, because the overall theme that I want to get out of this episode for the audience, for the listeners, you guys tuning in, is we're going to talk about marketing. We're going to talk about consults in particular, follow up, tech, really what makes a thriving practice going into 2026. So you went through that consult, and just talking to you offline, we were actually having an interesting interaction in terms of what a professional consult looks like, one that's productive, one that actually gets the patient the results, and ones that put you in a position. Because if that consult went a different direction,
Oh, right.
maybe it's completely life changing, right? So talk to
Yeah.
us about that. Yeah.
Yeah. So I think that consultations are the biggest bottleneck I see out there, a biggest leak in whether you're a small practice, large practice, all over. The amount of time I ask, so how long, are your consultations? Or even if I go, peep on myself and go book an appointment somewhere, it's like 5, 6 minutes. And I'm like, wait, what's happening? I'm like, is this part of their protocol? Like, does she want to know like why I'm here? And I want everybody to understand something like the client and patient that's coming in is actually more nervous than you are. And just like when you're dating someone, right, woman, you want to be led. Like you need to be leading your clients. They're there for you to help them. There's so much information out there that's already overwhelming, whether they come in with pre-notions or not. If you are not taking 20 to 30 minutes and using a mirror or, showing them, where there's a body part of something that they dislike or anything that you're doing, how am I supposed to trust that what you're going to do for me is going to work, let alone feel not like this, just like another number to you? Like, okay, I'm just like on your chopping block for the day. No, like take the time for me and get to know me. Like, you don't know if I've been to 10 other places. That's one of the number questions I have people ask in their consult, is have you been to another provider before? And if so, like, I would love to hear about that, because now they lower their guard down and you actually get to listen to them. And I think that we're so nervous, doing the consultation, or, some of your staff or whatever is so nervous, the providers, and they just black out. And I'm like, no, they're there because they need you to help them. And had that consultation gone a completely different way, like it did with the doctor's offices, no, no, I would not be. But guess what? She made me feel like I was seen and heard after being so frustrated. And I think that's what everybody needs to understand. It's like they're coming from probably a place of exactly where I was. And 95% of the time, it's true. Like once they ask those questions after I've trained them to do it, they're like, Steph, I can't believe that, like, that didn't even feel forced. I'm like, I know, because you're treating them like a human. And sometimes we just forget that, right? Because I get it. Everybody needs to have systems in place and things that are tick, tick, tick off the menu. But that's really what it comes down to, guys, is people just want to feel heard, seen, understood. They don't want to feel like another number. They don't want to feel like they're being sold to. They want you to lead them. That's why they're there.
Yeah,
I would be
take care
doing
and
you
get the outcome.
a disservice. I'd be doing them a disservice if I didn't do that, and that's that.
No, you're right. It's what's interesting to me is we somehow get locked up. It's almost like when you get on a sales call, let's call it, right? Or you're on stage, because we communicate every day. Us as human beings, you communicate every day with your spouse, your buddies, your girlfriends, your coworkers, your colleagues, like in the break room, the coffee room, whatever you want to call it. You're just having an interaction, right? You're asking questions and you're receiving those questions and you're having this ongoing dialogue. Why do these providers tend to get locked up in the consult? Because they are providers. They know that, look, they put themselves, look, I love providers, medical aesthetics practices. Like, I'm a huge fan of
Same.
what they do and what they provide. But for some reason, I truly feel, speaking real talk, they put themselves on a pedestal as a provider,
Yes.
right? And I like that. That's okay, because the education, the clinical, the aspect, the anatomy, the patient, I get that. But if you put yourself on that pedestal, we as the patient, we expect that pedestal to say, look, I'm here because I have a problem. Help me.
Yes.
Please
Yeah.
help me. So
Yeah.
why do they get locked up? Like, is it lack of coaching, lack of training? Is it lack of communication skills?
I think it's too much information. I think it's a lot of comparison. I think it's they think they need to have so many followers or look a certain way. I think it's mindset. I think it's, and me and you feel the same way with this. It's how you start your day too. Like if I'm coming in like I used to, bad out of hell, and I don't know my ass from my elbow, how am I going to be able to put that aside and like not turn my ego on real quick to just get through the consult and sell and just like be a human with a human? I always use this analogy, like have you ever been drunk in the bathroom and you're like, hey, bro, like I love your shoes, or like more for girls. And you're like, hey, like I love your shirt or whatever. And then you're besties for the whole night. Like there's no different energy there. You're meeting a stranger and you have to let your guard down. I mean, take away the alcohol, yes, but it's an analogy I use all the time. I go, what's the difference if me and you met, two champagnes in the bathroom, you told me you love my shoes and now we're exchanging numbers. It's the same thing. I don't know why we put so much pressure on it. And again, it's social media. It's what they think. This is the big one. What they think their patient is going to think. I
Mm.
hear it all day, every day, no matter how big or small, from owners and providers. And I'm just like, why do you think that? Well, I don't think that they're going to want to pay for that or do this. And I'm like, but you are attaching energy to something instead of just pulling it back. Okay, maybe leading with some good energy from the morning because you had your matcha and not 10 coffees and some peptides and
Yeah.
journaled or meditated or lifted at the gym. Maybe go, to a rec room early. I don't know. And yeah, but it's really about energy. It's about mindset and it's about the outside noise, how to turn it off. It's the biggest thing I coach. I'm like, what? Why do you think that? And do you think that they're going to be mocking you? Like you are an NP.
Yeah.
You have this degree that's amazing. You are a badass to them. Like, what do you mean? Like, so I think it's a lot of that per se.
You bring up a really good point. I like that you talk about being in the bathroom, a couple champagnes deep, cute shoes, cute shirt. That comes off so natural, so easy. Maybe it's, they're in this professional setting. They have this title, right? This badge, this star, if you will, that they have an MP, which is badass. It is badass. It's not easy to do. It's expensive. It takes
No,
time,
it's not at all. I
and
try to go back. No way.
not fun, right?
No, no.
My daughter wants to be an MP. She's 9, and
God bless her.
I'm like, go for it, girl. She's like, Daddy, I want to do the what do all the people that you work with do, the needle thing in the face? I'm like,
She's going to have great help because she's going to have a whole band of everybody that you know.
yeah, I will definitely be her first investor. That's for sure.
Yeah.
But it's this, they get concerned in the sense of what the patient is actually thinking and what do I look like. It's almost like it's the fear of presenting, and maybe they feel like they're pushy. They feel like I don't want to sell them if they're not talking about it. But really what I'm trying to get at is it's just question asking, and
It's
it's
a
just discovering,
conversation. Yeah.
conversation approach.
Yeah. How are you supposed to know what you like to eat? Like, here's the deal, right? My
Hmm.
boyfriend, he knows I'm gluten free. His dad almost died from what I have, like full blown, had to get taken back 3 times. The man had to ask me like where we could go eat, right? Even though he wants to lead, but he still asked me those questions to lead me, and I think that's where it kind of goes south. It's like, no. Sometimes two people come in like with their friend, Stacy, this one, Jessica, that, oh, well, I got this done. So you need to go ask them about this. And I'm like, no, absolutely not. Like the first thing you need to do is shut that down and say, I could have twins that are in here in triplets and all three of them are going to have a different consultation genetically. That's it. And then you pull it back and you lead them with your amazing brain that you just, are badass about. Like your MP badge, all those things, those are the things that they don't know. And like you're thinking that they're going to be like, because they're coming in asking because their friend got something done. It has nothing to do with their friend. They're just going off of what they see here, the phone, the last post they just saw in their face. But you have to pull that back and shut that down and be like, no, this is why you're here. Like, let's do this, you know.
You made me think. I mean, I've probably been in 100 different consult rooms. My
Mhm.
background has to do with, marketing, patient acquisition. That was my go-to-market strategy for the medical aesthetic space. I, founded Growth 99. I later sold that to an investment group. But, throughout that journey, obviously I went to practices and I still go visit practices. I own them through private equity. And I'm a patient, right? I should probably be more of I guess, a robust patient, more active patient.
Yeah.
I'm pretty active. Maybe I'm not as active as some, and I'm sure I'm active as more, but
Yeah.
I haven't had maybe two. I would say the percentage out of the 100 would be two. So let's call it 98% of the consults that I've had have not been question based. They have not told me about all the other treatments and services that they do at their practice. They have not asked me if I've seen other practices or providers, or they have not asked me, hey, what are your goals? Yeah, what is the objective here? Cam, you just turned 40, right? Here's what happens at that age. And what are you trying to? Are you trying to look young? Are you trying to be young? Are you trying to feel young? You want to be more physically fit? 100% of them have not put me on a treatment plan.
Oh,
100%.
100%. 100%. I just went to 10 last week. I just went to 10 last week and I'm like, okay, I'm gonna just let this. I'm gonna give 10. Big, small, medium, not one. Not one. And I'm like even giving them crumbs. I'm like, don't you wanna? No, not one. They are fully shut down. And truly, I think it's communication skills too, as well. The way that we do communicate in this world is all. I mean, listen, as a provider who's this age and as someone coming into it as this age, we all communicate that way. The problem is the way it's communicated and the way people take tonality through things like this
Mhm.
has created a barrier for people to show up and be like this.
Yeah, you're
You
talking about
know,
you're talking about scrolling on the phone, interacting, DMing,
yes,
texting,
yes,
right?
yes,
Yeah.
yes. Even the AI stuff that we do up front, as you're, front from your point of touch, right? You guys train them to do that, and that's fine. But like that's what they do. So if it's not backed or piggybacked with exercises or trainings to communicate properly with that, then they'll talk more on checkout. They will, almost like perk up when they come in and be like, "Oh my God, hi! Like we do have this," instead of hiding from it. Do you know what I mean? I think that that's also like a thing too. Communication has just kind of become laxed and weird and just, no one's reading a book about it anymore where I'm like, I'll read the next thing that's out, like who wrote this, to learn about it.
Yeah, that's why I'm a big fan of going to conferences too. You're forced to have face-to-face interaction. You're forced to get on stage. You're forced to be
Uncomfortable.
uncomfortable, and
Yeah.
that makes you grow. We're all, guilty of looking at our phone too much and DMing and texting, and it's
Yeah.
convenient. It's convenient.
Of
It's
course. Yeah.
easy. I'm at home. I'm in my pajamas, whatever. No one knows what I look like. But we are losing touch with that physical connection. And in the world of medical aesthetics, I don't know of a profession that is more about connectivity, longevity, communication, patient to provider interaction. Like this is a trust environment. This is a trust network.
Do you think that maybe some or most still think it's about vanity instead of that in some aspect?
100%. And that goes back to social media. It's the
Yeah.
comparison. It's, because we have filters on these phones, and everybody can post something and look beautiful, and then they compare, someone has more money than the other person, and shoes and purses and coats. And I mean, yes, absolutely. And it's like we all want to age like wine.
Of course. Yeah.
Yeah, I'm all about that, and that's all good. And there's some vanity in that. I think some vanity is good and kind of pushes us to level up. But, there's also human connection and touch. And really, there's an emotional aspect that's all about connectivity, and being who we are and being authentic is also really important.
It's coming back so hard right now. I love it.
Hmm. Hmm. Yeah, you see all these AI profiles, right? Like if you go to the last conference I was at, everybody's bio looked much different than them on stage.
Yeah. Yeah, 100%. Yeah, it doesn't make sense. Yeah, like what?
Like, damn, you look good in that picture.
Yeah.
But I agree. I think it's coming back, and I think this authentic touch, this real component, this connectivity is coming back. And that brings me up to what I wanted to ask you more on the console is what truly, like, let's talk about, and let's go through it. What is an average consult, right? Because again, you said you went to 10 practices last week. 10 out of 10 did not give you a treatment plan, did not give you a great consult. What did that look like? And then talk to us about what they should have done in order to help the patient experience and give you an outcome you're looking for.
Okay. Right away, I was like, it was like fumble right when you check in, there's also too many like apps and things to get like just checked in. from point touch, start. And I'm like, okay. Then they get me in the room, and then, no eye contact. Most, at least 90% of them could barely look at me. And listen, I get it. I definitely look a certain way, but I also went in gym clothes. I went in non-business attire. I went in 7 different ways to make sure that, vanity didn't play a role, because it can, and it comes back to that consultation I was telling you about before. Alicia could have looked at me like those doctors did and been like, oh, she's really pretty. There's nothing wrong with her. Because they actually told me that, and I'm like, no, there's something wrong with me. Like, I don't feel okay.
Hmm.
And I think that also plays a role into it too. But yeah, none of them looked at me in the eye. None of them had a strategy. Like, I could feel the energy of chaos. Like, they kind of were just like, okay, so why are you here today? Is it Botox? Is it fillers? Is it this? Is it that? I was like, well, for one of them, I did Botox. For one of them, I did fillers. For one of them, I did dermaplaning. For one of them, I did, I have scars from a mole that I had removed. So, they're great. My plastic surgeon was awesome, but they've hyperpigmented, especially from being in Florida. No matter how much SPF I use, that can also be from hormone problems. So, I'm like waiting for them to ask me, well, are these scars hyperpigmented from the sun? Not just the sun, but, is it because, hormone, like anything that could maybe spark that conversation that, your providers should probably know. They don't need to know it in depth, but something along the lines of, we know that most of the treatments we do play a role in helping hormone problems or skin conditions that adhere to that. Microneedling was pushed on me because it's like the easiest thing. And then, it's 350 right away. And I'm like, well, do I need one? Do I need two? Do I need three? I think they fumble over, well, if she's got pretty skin, how much does she need? And I think that's where like a lot of the miss happened in the consultations. It was like, I would come back with something to let them know, and they would kind of just like maybe take that in a way where it's not attacking them. I'm communicating what my problem is, and they shut down and be like, oh my God, so now what do I do or say? Instead of just like questioning the question with like a lead and just being like real with me, like, no, girl, like sometimes that can happen from A, B, or C, for me to then kind of feed off of that and be like, oh, well, I didn't even know that. So thank you very much, to then, right, education touch point. So there was just like, I think 2 or 3 of them gave me a mirror, which I cannot say this enough, guys. Men, women, we look at the mirror every morning when we wake up. Whether you go to the bathroom, brush your teeth, do whatever first, you do it when we're driving in the car and when we go to bed. So if you do not have that in front of them, me, right? And you are not asking me what I say to myself in the mirror in the morning, like, it's just me and you in the room, girl. Like,
Yeah.
listen, I'm like picking apart my face, right? My wrinkles, I look like this is sagging now. Like, talk their language to them.
Yeah.
They're waiting for that. It's going to let the guard down on both ends, right? Because then you can lead more. But no, and even then, they were kind of just like, oh, okay, so I think that I hear hyperpigmentation, and so let's just do like a peel. And I'm like, okay. And then how long is the downtime for that? And then they're like, oh, no, 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 maybe we won't do appeal. Maybe we'll just do this because, appeal can be like downtime and stuff. And so this is another thing too. I always help the providers when I go in and I train. You don't want to highlight that it's going to be a 72-hour downtime, because 90% of the time, unless it's a true downtime, it's not that long. Everybody that I've done a microneedle on truly has only been read for about 24 to 48 hours, if that. You know what I'm saying? With all of our aftercare serums and stuff that we can give them that make them heal in 12 hours, and like a mask to go home with. And so like if someone in the summertime, right, a lot of practices slow down. Why are you highlighting that you don't go out in the sun? We're adults. Okay. Put on sunscreen, wear a hat, wear sunglasses, and make sure that you're not frying in the sun. And you could get a microneedle in the summer.
Yeah.
We're grown adults. You know what I mean? So I think also too, the way that they're trained sometimes can highlight scarcity around doing the procedure, because then people are like, well, I have work tomorrow. And then they like shut down. And I'm like, no, no, that's okay. You lead them into saying, don't worry, we have something that can help you heal right after this. I'm going to send you home with 3 masks. By the time I call you tomorrow morning, you'll probably have this much redness. It's just, it. So don't shut down from it, So I think that consultations should be 20 minutes. I think the longest one I had in those 10 was maybe 10 minutes. And it was just babble. It was scarcity babble. It was them shutting down. Communication wasn't there. And I try to lead, and I think sometimes too, it's just like then at that point, the client and patient's just kind of like, well, I'll just do what they say. And then that's why they don't come back, or they'll give it one more shot, but you're not leading me into a treatment plan from, okay, I told you I had hyperpigmentation. I told you that I had scars. I told you that I have texture. I told you that my milia, girl, I am Italian. Those are hard to get out. Like, I'm going to definitely need some type of sandblasting laser that you have, and then I also want Botox and fillers, like I want everything. And instead of her even going to get another provider to come in to double consult me, which I love showing, go get me an injector. Let's tag team, you know? But, and then let's build a package together. That's a 6-month treatment plan. And I think that also gets lost too in practices. And I learned this in a lot of the consultations I go and I do see, is the aesthetic side, neurotoxin side is forgetting about this side, your aesthetic side. And they are so like not in sync and don't know how to like, no, you can create an $8,000 package and people will buy it and you guys can share. And now your lasers are being paid off and vice versa. And it's a whole beautiful situation. But that can't happen if you are not at all leading consultations like that, or grabbing your providers and having them play around during the week when it's slow and being like, no, let's create stuff. Like, let's be creative and fun. It doesn't have to be
Yeah.
so serious. So
Yeah,
that's what
they
I
get
took away from
lost.
it.
They get stuck in their comfort zone, right? They think that they're coming in
Yeah.
for the quick fix, and they get
Three
stuck in.
areas,
Yeah,
not just three areas. Like I'm in my 30s now. Help me out, girl.
yeah. I need like 100 areas.
Yeah, right. Like I don't need 20 units anymore. I'm okay with that.
Well, and it's like we're taking the time out of our day as patients. We can't come back
Yeah.
all the time, right? So like
No.
we're here. We're typically it's during business hours, it's during work hours when we're supposed to be productive as well. And so if I'm going to exchange this time for the money that I could be making, right?
Hmm.
Let's make it worthwhile
Yeah.
because I'm a busy professional,
Like lead
and
me.
let's go. Yeah,
Lead me to lunch. Are we getting
yeah.
sushi or what are we getting?
Now let me ask you, were those practices, were they established? Were they new? Was there
Some of them were
was
very established.
very established? You're talking
Like I've been
practices that
told to
have
go
been
there,
around.
and like people were telling me this is the place to go. And they look like they are. Like
Yeah,
tons of followers, gorgeous inside. Yeah.
yeah.
No.
Wow. Okay. So if and you're saying it was 0 for 10. Yeah. Yeah.
And
Okay.
in one area.
In one area, 0 for 10, one area. And after you gave them all this information, you said you went in with the disguises, right? You went in
Yeah.
with
Oh my God. Yeah. I went in. Yeah. I'm like a hat on. I mean, because I'm on social media, but if I'm going to go like, you know, do this, I'm not going to be liking I'm going to try my hardest to do market research. And, not one of them noticed me yet. I'm sure one day it will happen, but it's the best research I've ever done because I'm literally watching it from soup to nuts, from the minute I walk in to the minute I leave, and understanding what is the bombs are just going off everywhere. I see them in each room. You could feel the energy. Like it just, the owners, the amount they get pulled. 15 times I counted at one place, 15. And she's just trying to go to the back to have a meeting on a Zoom. And you can hear it kind of. I mean, like I'm paying attention, I'm alert, right? I'm obviously dissecting it. But the girls up front, just cowardly, just like, hi, I think you have an appointment today. Like just really like, here, just sign in. And I'm like, this is a nightmare. Like this, I would prefer if they stood with champagne and be like, hey girl, how are you? Like, let's try that for a month. And I know that happens if it's happening in 10 places in one area of a town. Like I can only imagine, and I'm sure you hear this. And this, again, I love big practices and I love everybody. I was that practice. I get it. It's the people I've helped work with alongside the stuff I've seen. I'm like, how are you going to grow if you can't even go make a cup of coffee? You can't even go make a cup of coffee. You've been stopped by the front desk girl 10 times for SOPs that are up there. Like, what's happening? So
Yeah, the SOPs have probably even been laid out if it's a big practice and they're just
no,
not
it's just
following it.
like one after another. And I'm like, how many freaking pages do we have to flip? Like, stop. Enough is and too much. Like it should be right here and it should be easy enough for them to even make it their own. So it's not so scripted,
Totally.
just it's yeah. And then what else did I see? Just chaos. chaos. Products out. Like, well, okay, that's great. That's fine. Do you have a drop shipping? Like, can you get it sent to me?
Can you talk about
Um,
it?
huh? Me?
No, no.
Like, oh yeah,
Yeah,
can
can you
they talk
talk to
about,
us
yeah.
about your inventory? Can you talk to us about the
Yeah,
availability?
anything, anything. Or if that's out, don't highlight that it's out. Have a backup plan for me.
Mm-hmm.
You know what I mean? Like,
Yeah.
I always say have a plan A, B, and C, because if they don't shoot high, they won't go low, and the medium is usually a sweet spot for anybody to even be slightly open to it. But you've led me, and so if that's too high and that's too low, there's a sweet spot for everybody, and you can design those numbers in cherry payment. They help you break it down for payment plans now. It's super easy. Like, takes 10 seconds. Everybody gets, okay. There's no hard credit check. Like, if you, I think you asked me earlier, like, what's another company? Like, they're great. Care credit's good, but there's no interest. Like, cherry payment's awesome. They're great. And it takes 10 seconds, and you don't have to deal with the payments. The your clients do. That's on them. You get the money up front. It's great for your estheticians and your, NPs and injectors to dual, like, people are buying $9,000 packages for 6 months treatment plans or less than that without a blink, and using those
Absolutely.
if it's done right,
If it's done correctly. Yeah.
Yeah. Yeah. But yeah, product was definitely a problem. Confidence, just like, I think you know overwhelm. There was two that were actually filming stuff for social media, which is fine, but like, I'm also down for like a day. Like, I also think practices need to understand, like, you can literally make 3 months of content in one day. Nobody cares if you have the same hairstyle. Like,
Mm-hmm.
nobody cares that you're in the same stuff. Make it, have the person edit it, have it be done a month ahead. That's it. You don't got to worry about it.
This was a shoot, a social media production was going on. You as a
No,
photographer.
no, no, no. I
Okay.
no, it was like many things that they're doing,
Sure.
but
Okay. Okay.
but definitely messing up the flow of, like, the front of house, like,
Yeah. Yeah.
it's,
Yeah. That's what I'm
you
getting
could,
at.
yeah, definitely, yeah, like, two of the
Wrong
girls on my
time,
app.
inappropriate,
Yes,
not a nice
yes,
product.
yeah, yeah. I thought you meant like a full blown, like, lights. I mean, they probably should have had that. It probably would have been better. I would probably
Probably would have.
respected
You're
it
like, hey,
more.
let's jump in. Let's do this.
Yeah, but
No,
like,
I get it.
save that stuff for after hours, before hours. Like, it's cute and fun. Or if you're gonna do that, include your patients up front in it. Like, make it fun
Yes.
and interactive.
Yes.
So
Yes.
you have
Absolutely.
testimonials happening in the moment. Like, oh, you just left? Hey girl, like, how was your treatment? Like, make it funny, make it real, make it a story, but like, no. And then what else did I see? People just like, on their phones and just whatever,
What should you have seen?
none of that. Great energy. Oh my God, hi, how are you? How are you doing today? I'll be with you in just a minute. Just taking initiative, even if these things that we have to hand them are internally, like, stroking me out because I'm the front of house and it's freezing, or something's going wrong. Like, have a plan of action to offset that. So you're ahead of the uncomfortableness. So it doesn't make anybody else uncomfortable. Communication of energy, body, and at least that part, right, for the front of house. Or, I'm like, do you want a cup of coffee right now? Like, are things spazzing out? But like, I'll just go, like, turn it into a funny joke. Like, let them lower their guard. They're already, like, maybe overwhelmed. Another thing too, to offset that, I know a lot of providers send out stuff to fill out beforehand, but a lot of
Hmm.
clients don't listen to that. So something I've actually implemented with many providers I've worked with is a fee for that. A professional text message that goes out with everything else and says, listen, this is our third time letting you know. If you do not, fill out these medical clearance forms prior to your appointment, you will be charged a fee for it, because it will carry over into the next person's time. And that kind of also alleviates a lot of that stuff. And you can do it in a very professional, nice manner. And if those people don't respect that, then they're not clients for you. But I highly suggest anybody listening to this try that with any CRM they have that's sending out stuff, because I'll tell you right now, the providers I've done it with, the clients, the new or old, they'll do it.
Yeah.
They respect it. I should have seen, just calmness. I should have not seen, if the owner was going to be there, the owner should have been there, saying hi to me, thanking me, leading her team. Not, oh my God, how this, like, you could see her trying to make the cup of coffee and then go in the back. Whether, I mean, big, small places, big and small, just the phone going off, just like a lot of stuff, just chaos. Chaos, chaos. Being brought in the room, having to wait, I think, two of them. The girl left once or twice when I was getting my treatment done for one of them, which is fine. I know some people do stuff like that, but I would communicate that if I had to. As a provider working in an establishment, I was not led at all upon checkout to do anything.
No
And all 10
process.
of them. No,
No
no,
process. No,
just
no, no review requests. No
no,
memberships. No retail. No, let's rebook you.
no.
None of that.
At three of them, no, hold on. At three of them, they had so many things happening, promos, just too much, right?
Too
Like
much. Yeah.
they didn't know how to talk about it at three of them because
They're
it's
very
like
confused. Right.
I'm like, okay, so this is the monthly special. This is like a membership, like some of them had mentioned some things, but like a lot of it was overwhelm mentioning. That's what I was looking for. Overwhelm mentioning, like, we have this, we have this, we have this going on. But I'm like, but what is the actual thing that is like, it's too much.
It's too much.
And
A confused buyer is not going to buy.
yeah, just like when you go into you walk into the front of house, if it's overwhelmed with pamphlets and all this stuff, like you're overwhelming me already.
Totally.
I think each place should have a specialized provider in each room to lead, one for melasma, one for acne, one for this, one for that, and you guys all just cohesively work and create packages together. It'd be a beautiful domino effect,
What are your thoughts
cascade.
on having an MA in the room?
I love that.
How many MAs do you think you need per providers?
God, maybe two. It depends. That really depends on numbers and staff and stuff like that. But I think that that would definitely up level the miss of certain things there. Because I mean, let's face it, every dermatologist office you go to has them. It's the in between. It's a touch point in between, which I absolutely love because it can make something so far come so close with just one simple additive.
Yeah. Yeah.
Yeah. But I mean, if you have 10, maybe two, you'd have to test that out. See, it's a numbers game, right?
Yeah, I think so. And I think having an MA can be super valuable with getting the room prepped, so that
100%.
patients can keep coming in with a sense of calmness and you just
Yes.
focus on listening and interacting and not having to do,
Yes.
drawing up the toxin or
Yes.
whatever you're doing. Right.
I especially think with HRT, I've seen a
Yeah.
lot of providers that, I'm like, okay, but you're not now taking them to go book them for the next 3 months. Do you know how much money's being lost? And then it's a whole process of calling to schedule their blood work for pellets. I'm like, no, no, you leave the room. I got it. I'll clean it up today. You go. So 100% agree with that.
Okay, I love this. This is amazing. And so there you have it, guys. Like consult, treatment room, communication, treatment plans. She went to 10 practices and there's this in disguises, and so she's not just saying, hey, here's my thoughts, here's what I think. This is the reality of what's taking place. And I also see another gap as well, and I talk about it quite a bit, but I'm a big fan and big believer that marketing is still the number one lever in terms of everybody has to know who you are. Okay. Everybody, if you're a real estate agent, everybody has to know you're a real estate agent, And so if you own a medical aesthetics practice, you're a provider, everybody has to know. And we have all these amazing channels if we use them to their ability, websites, social media, podcasts, YouTube, whatever it is. And they're underutilized or they're not, or they're used in an inefficient manner. And I think, a lot of times the marketing that's online doesn't represent the physical practice.
Never. Actually, I could attest to that. Every practice I went to, I was like, so I'm like, wait, this is this big and it's this, and then this is this small and could be this.
Oh my gosh. I bet that's a common theme. It's the ones that
100%.
have been around a long time are the ones that are big, but it's small online. Is that what you're saying from a digital footprint? But the ones that are actually small have a big online authority.
Mhm.
Oh my gosh, yeah, that's
Yeah.
disappointing. This very disappointing.
It's anything can be bought and said now.
That's right.
So it's okay if you shop around and find your home because that's an okay thing to do. I think until we get it all figured out, and that's what will happen. That's a message for everybody. That's what's happening. Is I shopped around. Like I was undercover and I had to shop around. I didn't find hope in 6 hours of my day. Not even a glimmer of it. So
So let's talk about the big thing that's small online, right? Because I think that those are the providers. Those are the well-established providers, I would say, or practices that have been around. And sometimes there's this notion that they don't feel like they need marketing, right? You and I both know that's not true. Why is marketing still the lifeblood of a med spa and will be for incredible providers?
oh my God. Well, if like I think I mentioned this to you earlier, right? The woman that I'm helping on Long Island at the moment, open 5 years. Never once was she ever on her social media. Worked with the marketing team. They talked her out of her showing herself. And I straight up, once that was done, said the first post we're making is a about me post of why you left, cardiovascular and why you opened your practice.
Mm-hmm.
Do you know she got 7 clients in, I think, a day? Because people that are watching, okay, because that does happen. You do get follows, you get some people that shop on your Google ads, everything you are doing on the other end, but there's nothing for them to stick because they don't even know who you are. Like, why am I going to invest 5K if I don't even know who runs the practice? She got 7 clients from one post, just from letting her be like, hey, I'm the owner. I'm the owner. So I think that, there's a whole notion here where it's like hide and don't be seen and have your team lead. But if you're changing your team like underwear, that's not going to stick either. Like if you're doing another big photo shoot with your team every other holiday and I see 5 girls gone, what's that tell me?
Mm-hmm.
So it's almost like a backward, you're, smacking yourself in the butt there too. And you're so busy, you can't even realize that because you have a marketing team that's doing that. Or like a good person might be like, no, let's not, doesn't really look good. And then so on and so on and so on. Like if I don't know that you are in chaos as a business owner, like I want to see that. I want to see that I spilled coffee on me and then I have 3 cancellations and like now I got to hold a staff meeting. But it's okay. We're okay because we're good. Like the whole way that they're led to be Barbie and this and that or vanity, it's
Mm-hmm.
people are over it. They're sick of it.
Well, it's everywhere.
They're sick of it. Sick of it. And if it doesn't make sense to me when I walk in, I'm going to stay for the consultation, but I'm definitely like, this don't look right. What's happening?
It's a misrepresentation.
Yes, it's not warm. It's gross. It's not nice. No one likes it. It makes people's skin feel like, okay, what am I doing here? And then they feel bad for making the appointment and leaving, and then they want to run out of there. And then that's where the reputation becomes, because I asked around, my parents' retirement community, and I'm like, these women are that age bracket that really need and will spend it, retired, tons of money, right? And they're like, yeah, no, we'll never go back. And they gave me the names of 5 of the places I went that are big places in the surrounding area in Hudson. And I'm like,
Mm-hmm.
all right, I'm gonna go.
Yeah.
Yeah, I'm even thinking about doing like a clip series with them, not to mention the places, but just to be like, hey, like, would you not like? And they straight up told me they were like, yeah, no, didn't work. Stuff was diluted. Like they could feel it. They knew. They were like, they look like this online, but you walk in and it's just like, have all these perfect, bubbly, like, people, everybody could say hi and look cute, but
Mm-hmm.
they were like, I'm like, you just got Botox? I'm like, why didn't you get PDO threads with this, with that? I'm like, not for nothing. Like, I'm sitting here talking to you and you're open with me. So I'm telling you what you need. They're like, yeah, no, you should just go and work there. I'm like, I can't. But, it's too much. It's too much of what we think we need to look like instead of you need to lead as the business owner. People buy for my brand. Remember that people trust and will invest in anything that they trust, right? Emotionally, physically, mentally, and just safely. You know,
They need to
they're
look
not.
at that. I mean, they need to, it's hard to build a brand. And, I mean, it's injector this person, or their area. And if you look at building an actual brand where people trust that brand, they want to wear that brand, they want to represent that brand. Over time, you don't have to spend as much on marketing, right?
No, you
Because
don't
you're
even need
you're
to
out in the
spend them down.
community. Yeah, you're in the
Yes, yeah.
community. I mean,
That will also build referrals a lot faster too. I think a big thing I hear a lot is like, well, we have referral program, but it doesn't work. And so I'll say to them, okay, so how much is your referral program? 15% off. And I'm like, so hold on, you're just going to sell me a $3,500 package and give me $15 off? I go, that doesn't make sense. If you give me a $150 credit or $200 credit, you can eat that
yeah,
toward anything. And then you give the person I refer that, I'm calling 3 friends in the car. But also, right, if I go to your establishment and it doesn't match, do you think I'm going to go talk about you properly in the community?
no,
It's not
The
going to
physical
refer.
location has to
It's not going to
match the
refer.
digital location. Yeah.
Yeah, it's not gonna. That's why I think a lot of referrals have dropped. I think everybody's so hyper focused on I need followers and I need photo shoots and I need da da da. It's like, no, you don't. Really, I promise you, you don't. You need to show up, be the leader, have your team be there with you, be funny, be interactive, be silly, be crazy, be all the things, because that's where the people want to go. And that's where they are going.
And that's where they're going to continue to go.
Yes. Yeah. So yes. I mean, listen, pay for marketing, do all that. But if you're being led to quiet your voice and your brand,
Oh,
maybe don't listen to that. And also, if you have a friend that you're bartering with that could do it for cheaper, please, for God's sake, stop that too. Because what ends up happening is I see a lot of friendships ruined, but they're not helping you. They're not professionals. And even if they are, they're running their own business to cut costs and start that way or even be in 5 years and fix that way, bad.
oh my
Just bad
gosh.
news
I
bears.
love that you brought that up because I
Bad
heard
news
that
bears.
so many times. Well, I mean, I have a deal worked out with one of my
Like,
patients, or my
no,
friends, or my
cringe.
cousin's sister, or like someone, has a website company on the side. And
I was the one that did that. Okay, I did it. I did it. Lost a lot of money. Okay, I had to spend triple. So I'm telling you, begging you, don't do it. Fire them tomorrow, please. Yeah, it's I'm serious. I
oh,
waited forever for a website to be built from the person that I'm like, oh, it was great when I got it, but I'm like, oh my God, I'm open. Like I need it now.
yeah.
Now.
I need to be found online. I need,
Yeah, you have your Botox. You look good. I need it now. I need my stuff, or and then it's hard to have the communication with them without them getting butthurt. It's, like just do yourself a favor, find someone that wants to build your brand and have you be you. Do not dim your light down for anybody. Have your voice, be a provider that is in people's faces about how you feel.
Yep.
Have a team that's the same way and you will grow faster than anybody else.
Now, what about the follow up, right? And let's build on the secret shopping that you went through.
Yeah.
Has there been follow up? Have you received
I've
texts?
gotten a
Has anybody
million
called you?
bunch of texts.
Bunch of texts. Any phone
Yeah.
calls? No phone calls.
I mean, granted, I didn't get anything that severe that there should have been, but again, it's a touch point.
Yeah, I would
Especially
expect at least
if,
one.
yeah, well, it's all been AI stuff, which is fine. Run your business on AI. But I told you this off camera, right? The day that I almost died and I got diagnosed with Crohn's, like the doctor that took over my care, that man was in surgery for hours, called me at 10 p.m. at night when I first started my first injection, which I had a reaction to, by the way, and it kept me so calm or whatever. Like I was on Humira first and my body grew the antibodies to it. And I had like this, I'm like, oh my God, I'm sick again. And he's like, no, you're not. Like, we just got to find your right medication. Started me on the next one. He followed up with me for a week straight every night after surgeries. And if I have an emergency now and it's a Saturday or a Sunday, he will find the time to call me
It's unbelievable.
himself. And he runs a huge practice and has a bunch of, staff and like it. So I see it. If you want to, you will. This can go such a long way, especially with people that have not even so much the downtime appointments. I know that everybody has like a protocol follow up for the 72-hour, 48-hour check in. But what about the ones that just come just because they were curious about you, that want you to lead them into Botox and fillers, but are scared, from what they've seen on the internet and stuff? Telling them to come back for just like a 2 week check-in and giving them something to get them to come like stay, like even if it's for free.
Yep.
Sometimes you have to like take people out to dinner and buy them cookies and bring them coffee. Like no one's just gonna be like, hey, okay, like let's go to third base. No, like no, it's not how that happens. You have to sometimes,
You got to work it.
yeah. So I think that that's a big miss. I think that if your provider that did the actual treatment on them and they're trying to build their books on top of this didn't take their downtime to just call them and just like, hey, listen, I know I just did a facial on you, but honestly, like I loved our conversation in the room. I'm just wondering how your day's going and if you had a great experience here.
You bring up a point in the sense of having to work it. It's like take them out, do something for them before, you're not going to get to third base, hit the home run, hit the grand
Yeah.
slam, right? Like,
Yeah. Of
I get that. And I think that, AI is important for the sense of having some automated follow up, some systems, some tools.
course.
I think
Of
you can
course.
massage it in a way to make it not
Yeah.
look like AI,
Yeah.
right?
You could change your messaging.
You can change your messaging very easily, maybe less emojis, take out the stupid dashes, make it
Yes.
personalized, say, hey, this is so and so from this practice following up, right? Take the time to actually, double down on the messaging that goes out.
Right.
But why don't practice owners or providers do a better job of business development, within the community? Like, let's say you live in, let's call it Utah. I'm from born and raised in Utah, Salt Lake City. There's a very robust entrepreneurial state. I would call it a social media influencer state. I don't know what the
Mhm.
stats are, but there's a ton, for whatever reason, there's a ton of influencers in Salt Lake City, Lehigh.
Yeah, because of the housewives.
I mean, yeah. And they were actually my first customer years ago.
Uh,
It was,
So
oh my
funny.
gosh. Yeah. So why not do some business development and go after those influencers that have reach through social and make them, have them, if you can handle it, right? Have them become your patient, right? Work it because they have reach. And if you win them over and you take them through a great consult and they love the experience and you gave them a great patient outcome, right? What are your thoughts on that? I don't see that happening at all.
I absolutely love this. And I actually work with a lot of solo providers where I've built their businesses from very little to very quick.
Hmm.
One girl last week got 15 inquiries alone just from a content creator going. But here's the thing. She's the first melanin rich microneedling specialist we're building in her area in Vegas. And she had her model who was melanin rich skin, right? The person that fit that vibe for her was perfect. So what I basically do is it's a strategy and it's an influencer. You have to shop around for them because I think a lot of people also have this innuendo of like, oh my God, I don't want to deal with them.
Hmm.
And listen, a lot of them have built that name for themselves. But here's the thing, you can find your ideal avatar influencer who will build your entire practice. You don't have to, and I think some of them have tried, but they've done it in a way where they're just giving stuff away. They have not led with, no, you're going to sign this document. I'm going to do this for you. You're getting free treatments. Like they did not lead even the influencer into something that could build them. So I have them build out a kind of like a contract agreement where the influencer has to make sure that they're posting them enough to get them some clients. There is no freebies. There is no this. That has to make sense. You're not going to have someone if you are, an HRT clinic come in and they don't have hormone problems. Like you should probably have an influencer that deals with PCOS like me or something like that. So I think that if you just did it as a strategy and you took the time, I think it could blow it out of the park because I've seen it happen. I just think that some of that stuff, just like social media does everything, dwindles it into bad, and you just have to find the good. But 100%, I don't believe it's being utilized at all. And you don't have to take the ones that are pushing you into giving them their free stuff.
Yeah, I agree. I think you have to approach it in a way that you want to land a client.
100%.
Right. It's like, hey, you know what? I'm going to go identify 5 people or 10 people that are in my local community that have reach within the local community. They're not selling like Amazon online affiliates across the nation. That's not going to be your, let's call
No.
it influencer, right? These are called key accounts. Like these are called key clients, if you will,
Yeah. Yeah.
and do some business development and go after them.
Yeah. It's such a big thing. Even networking events they don't go to. The first question I ask on an onboard call is like, well, when's the last time you've even gone to like a coffee meetup in your area? They're like, what? I don't have time for that. I'm like, well, then you're the problem. If you cannot go to every conference, like you should be able to, as the business owner, make sure, don't bring your whole team if you can't, because that's what's helping you. But you need to be in every room of every conference that's valuable to you. And it needs to be a priority. It can, like, kids, not, I understand people have families and stuff, but 90% of that it's no one's going to come to you. And I think that they get so frustrated with social media thinking that because that they're paying for it they're going to come, but no one knows you in your hometown. Like there's no trust in your actual community. So another analogy I use for them is, the bakery you guys always go buy your cakes from for your kids, like that baker used to give that first customer coffee and bread to give to his neighbor for free
Yeah.
and gave it to Joey. And then bought Franken, and then Frank bought Salad. And then that's how the bakery has succeeded for 90 years because the guy literally gave his donuts, his last crumb to anyone who would try it to have trust built and family and whatever. So if you want people to buy your cake, you have to be seen in your in your area. Pop-up events are cool. I think holding events are great, but those sometimes also flop. Like you don't have enough legwork done in your community to even think that people will come and knock down your door for that. And then they get pissed off. I'm like, no, you didn't sell out your event that the marketers told you to do because no one knows who you are in your town. They don't know who you are. They've never seen your local coffee shop.
Yeah.
You know, they don't see you at the whatever meetings that you're there. Like they don't see you. They don't see you maybe trying to go talk to even the schools, the moms, the whatever. I don't see you at a baseball game, basketball game.
Yep. PTA programs, all of it. Yeah.
Yeah,
Building a
like
community.
the tiniest stuff that, I guess is kibbles and bits now because it's not so
Yeah.
flashy is like,
Flashy.
no, that's what will keep you in business for the next 20 years.
Yeah, it's that local community, local touch. It's really building yourself as a local celebrity within your area of expertise.
Yeah. If you don't have time during your day to day to leave for 20 minutes to go door knock and shake hands with anybody in your town, regardless of how busy, big or small you are, you're capped. You're capped. You can't go have pizza, the guy that makes the best pizza in town and do a video with him. Like, come on.
Yeah,
You
imagine
know?
all the shares that we'll get from that.
Yeah. I don't get it. I don't know. There's a miss.
Yeah, yeah. And I mean, that's what I wanted to get out of it. Was the marketing, the consult, the follow up. And I mean, some are gonna thrive this year. I know that
Oh, yeah.
there's practices that have their shit together. The details of that is and the data shows that it's low. I mean, there is what 12,500 practices around the country now.
Yeah.
I think the one-to-one comparison on McDonald's is actually pretty damn
Yeah.
close. It's not off by much.
No. But people have the money to spend and they're ready. And that's also another thing, this whole mindset of they don't have it. Yes, they do. They're going everywhere else but there. I promise you they are. Because how do we know? How do we all know this, but we're wrong? No, it's just that's the ones that are waking up that are like, hey, they're crunching their numbers like, okay, I've been paying for this marketing thing. I haven't gotten one thing. That's another thing I do. 10 seconds. I'm like, show me how much you spent on it. Just show me. And what is your ROI? 10 seconds. No, done. This is how much you've already put in. I know that they tell you it takes this long, but absolutely not. Because I could show you how to do it in 10 seconds for free by taking a half-hour break and just sending messages to people that have liked your stuff. Truly, you know what I'm saying? Like you're missing even more from working with them than what's right in front of you.
That's
Sometimes.
crazy. It's so true. So
Yeah.
true.
Like, have you even thanked anybody for following you? For real? Like, thank you so much for following us. Like, did you follow because of the vibes or because you were interested? Or like maybe if you are a provider at night, the owner, and you're laying in bed and you're spiraling, go look at how many people are watching your stories and send a message to them late night. Hey girl, thanks so much for watching our story today. Did you like it? Like what I see you watching. Like just say hi. Say hi. That will get you more clients than the ones you're trying to get from followers. 100%.
Yeah, interact with them.
Yeah.
They're
And your
watching your
front desk
show.
could do it too. Your front desk could do it in downtime. Your front desk could get you more leads than some of the follow-up texts that are going out on your Instagram. I promise you they can.
Totally. What is
So.
for 26, right? Going into 26, we're almost, January is going to come to an end here, which
I know already.
it's already going. Give me three things that practices if we want to grow in 26, right? I want to grow by 20%, 30%, maybe as a high marker. I'm not asking to shoot for the stars, but
Yeah.
I want to have a healthy practice. And that's the other thing too we could talk about is I think practices think that they need to double their revenue every single year. Which look, if you're doing 50, 20, $100,000 a month, sure, that's doable. But if you're a
100%.
multi-million-dollar practice, you're not going to
Yeah.
double every single year. Let's just say you're $3, $4, $5 million practice, 20% is healthy growth. Give me three things that practices should do in 2026 if they want to have predictable growth.
Stop trying to grow backwards. Like stop trying to be everybody else and grow as fast as them to buy whatever they already have because you don't know if they've worked hard for it or not, if it's organic or bullshit.
Mm-hmm.
And focus on the internal of, okay, if my team's not strong, how do I make it better? Not with more trainings and information to shove down their throat, but mindset shifts, workouts together, I don't know, like hold planks together and figure out a package. I don't know, like team building skills, communication, psychology. You want a bomb front, whether they're AR or not, make sure that they know emotional psychology through and through. Hell, hire a psychologist that's your front call center. You probably could quadruple, but like get really good at that stuff and listen to what we're telling you because it's the truth. Like, do not try and grow outside in. And the ones that have peaked, stop wasting the money on the things that you think are making you grow. These marketing teams, these all these gadgets you're getting, like another laser that's going to put you in 200K worth of debt is not going to help you. You don't need 10 new retail. Like, stop trying to be nicey nice with all the reps. Stop, get a hold of it, invest in things that can help that before you bring it. And you don't need 50,000 followers for people to like you, come to you. Go walk in your town, go break bread with people, go bring people a sandwich, go buy coffee and go pop into the boutiques. Those women will love that. Like, be connective. And so that's right off the rip, the first one.
Shit, that was a lot. I love it. I think that was like 10 in the first one.
Oh, that could be all of them, but I just like, yeah. But yeah, and then I really think like get this whole get your shit together with how you start your day, because it made me sick. Truly, honestly, like you can have a heart. I think I was listening to one of your, because I love your podcast. I listen to it all the time, and I'm just so thankful that finally
Hey,
I'm
thanks for following. Thanks for tuning
talking.
in.
You know, if this isn't started, I'm like, oh, this guy's great. But anyway, mindset's huge. Heart attacks. You spoke to one person about like how many people were actually having heart attacks. Like the two women that kicked off my company, right? That I helped, two providers that own MedSpas, shaking, chain smoking cigarettes, like, and had peptides in the fridge.
Gosh,
Wine. I'm like, listen to me. This is, I get it. But like,
this is
you
not
guys are
fun.
good at what I'm
Yeah.
saying, just to get rent.
Yeah. No, you nailed it. You absolutely nailed it.
All
All,
that.
yeah, I mean, show up as a leader, get up early, show up with good
Yeah.
energy, ready to go, get your team organized. Yeah.
If
Yeah. How could it's like trusting you can't have a personal trainer that's overweight, like
no,
it's not going to
it's,
work.
you
No, you're
can't look
exactly right.
haggard. Can't look
Exactly right.
haggard,
No, you
you
can't.
know.
You
So
have to have all the shit done. You have to walk what you preach if you're going to be that provider,
yeah,
if you're going to provide that
even
expertise.
on the,
Yep.
and it's discipline.
Yeah, that's what it's about. It's discipline, doing the shit you don't want to do when you freaking, you know you have to do it. You don't want to do it. Do it
Yeah,
anyway.
for
Yeah,
real.
absolutely, totally.
Yeah, yeah.
Well, I've enjoyed this. This has been great. Thank you so
Me
much
too.
for hopping
Thank
on.
you. So
Yeah, they're definitely, there's some maturity that's taking place. That's for sure. And it's going to take more of these conversations. It's going to take
yeah.
more of this vocalization and spreading awareness and having
Hmm.
more, business acumen sense within the practice. Like I totally agree. And
Yeah.
I want to have you back on. I think that we got through basically like half of my talk track. So I want to have you back on. But for people that want to connect with you, what's the
Yeah.
best place for them to find you, get to
That's,
know you? Awesome. Okay.
but
Well, you
that's
guys
right in
have
my
it.
link tree. Super easy.
Go follow her. Go check her out. She's got an incredible value, guys, and she's real. And she's been in the industry a long time. Obviously, for everybody that got to this point, obviously enjoyed the episode. And do me a favor, share it. If you guys found this particular interview, conversation, touch point, share it with your colleagues, share it with your team, share
Yeah.
it with your family, your friends, whoever, that can benefit from it, even if they can apply the methods to their other businesses, right? So it's about sharing the value, giving back to the world, giving back to the industry, of course. And
Hmm.
yeah, go follow her. So I'll leave it at that. Thank you so much, guys. Until next time, happy injecting.